So I'm Dr. Nicole Pelly. I moved to Idaho a couple of years ago from the Seattle area, and I'm originally from the Midwest, so I'm enjoying having the 4 seasons. I love being outdoors. Trees and wind are my thing. I also have a 6-year-old son, so I spend a lot of time introducing him to the outdoors. I'm an outpatient palliative care physician at Kootenai, which means that I take care of patients in the clinic setting and talk with them about palliative care. I'm also an anesthesiologist, and in my work in anesthesia, I helped patients in intense ways get through operations or through surgeries. I chose palliative care because there are similarities to helping people who are suffering get through an intense period in their illness or their lives. So there are actually more similarities than there are differences. I liked Kootenai because of its unique size and highly qualified healthcare providers, I would have to say. I came from a background at the Mayo Clinic, so the fact that Kootenai was a part of the Mayo Care Network was a big reason that I chose to come here. It meant to me that Kootenai had Mayo's stamp of approval, so to speak, for providing really high quality healthcare, and that was important. They can expect that I'll get to know them as a person first before delving more deeply into their illness. At the very heart of palliative care are patient stories. Who a patient is as a person is essential to understanding before we can really start talking about quality of life. And a patient's quality of life is then what helps us decide what kinds of treatments do they want to continue or to stop, or what choices do they want to make. Without knowing who the patient is as a person, we really can't help patients make those decisions correctly. So they can expect a lot of questions about what's important to them, what gives them hope and meaning in their lives, what are they afraid of, who's important in their life in terms of making medical decisions, and who's on their team, so to speak.